So it was identified in South Africa, and it looks like right now it's starting to outcompete Delta, which of course has been the dominant strain across the globe for many, many months. And if we look at what's happening in South Africa, it seems to be outcompeting. So it's causing the majority of new infections in South Africa at this point. It's really hard to tell if this new variant is going to be more virulent in patients. So is it going to cause more severe disease, more hospitalizations, more death than Delta? We don't know that yet, but it does seem to be more transmissible than Delta, which means that in our communities, in unvaccinated people or in people who have waning immunity from vaccines, we could see increases in COVID infections, perhaps caused by Omicron. So I think what many of us are doing now is following what's happening in Europe, since we seem to be a couple of months behind what Europe sees. Europe is starting to see Omicron cause more infections and start to compete with Delta. We're still a couple weeks away from knowing if those new infections will lead to hospitalizations. That's how COVID typically works, as you know well. We start to see a rise in overall infections, and then some of those people go on to get better, and some of those people around day 10 get worse and then need to be hospitalized because of respiratory distress. And so we're still, I think, a couple weeks away from understanding if this new variant will cause more severe disease in people. In that, is it causing more hospitalizations, more ventilator use, more deaths? We still have a lot to learn about whether or not the vaccines will be as effective against Omicron as they are against Delta and the other COVID variants that we've seen thus far. And the same is true for therapies, but the fundamentals of public health remain the same. This is a respiratory virus. It's transmitted through respiratory droplets, which is why masking is so important, both to protect yourself and to protect other people. Hand hygiene, social distancing is all important. And then of course, while there's been a lot of media attention on this newer circulating virus, and we're all scrambling to learn as much as we can about it, the important thing to remember is that for us in the United States, the majority of our infections at this point remain Delta. So somewhere between 96 and 99% of our infections right now are still Delta. And we know that the existing vaccines and existing therapies remain very, very effective against Delta. And so our push from a public health perspective, beyond masking, hand hygiene, social distancing, is to get vaccinated if you're not. And if you are vaccinated and have not yet had a booster, please go get a booster. It's now available for everybody who's over 16 and older. And we are finding that over about a 6-month period, people's immunity from the vaccines does wane, which makes them vulnerable to infection again. And so if you're at that point where you're 6 months after the second dose and you're over the age of 16, please go get a booster. Yeah, so a couple of things. There's a number of misconceptions. You hit on a few of them. So of course, there's still this idea that masking is really not effective. And that's, at this point, indisputable. There's been a number of studies performed by a number of different organizations across the country, across the globe, that can model out the impact that masking has had on decreasing transmission and preventing new infections and deaths. So that really at this point is indisputable data. Masks do work, social distancing works. We know that the vaccines work extremely well. Even if we look at our current inpatients, while we've seen waning immunity over about 6 months or so, 75 to 80% of our COVID patients in our hospitals today are unvaccinated, which tells you that the vaccines are effective. So even if we have increased breakthrough infections, we have people who are fully vaccinated who do get symptomatic COVID and need to get tested, they're very unlikely to be sick enough to need to come to the hospital. And that's what the vaccines were trying to prevent, was to prevent people from developing severe disease, hospitalization, and death. And the vaccines very much do that. You know, I think one of the things for people to remember, so I know that there's a lot of concern about this newer circulating variant, and for people to remember that these variants arise when there is rapid viral replication. And so if we want to get to a point where we're seeing less new variants, we need to make sure that as many of people in our community are vaccinated or do what they can to prevent new infection, because as there are pockets both in our community locally or across the country. Our country is about 60% fully vaccinated, which means that there's still millions and millions of Americans who are not vaccinated and are thus vulnerable to getting COVID. It's in those communities where we're going to start to see the development of newer variants. And some of these variants might be less infective and less contagious than Delta, and some of them might be more so, and we don't have a way to predict. And so it's really no surprise, I think, to anyone who studies public health or infectious diseases that we saw Omicron develop in South Africa, which has less access to vaccine than other parts of the globe. And so really for us in a country where we're very privileged to have access to vaccine, where it's free and readily available, if we truly want to get to a point where we're past this pandemic phase of COVID, the most important thing we can do is encourage those around us to get vaccinated.